We'd like to welcome Dr. Brent Coil, who is a family practitioner with Nashville Medical Group. We're so glad that you took some time out of your busy schedule to talk with us today.
Well, thank you for the invitation.
This is the time of year where you hear cold and flu season. Everybody is kind of in a tizzy over cold and flu season because you know it's coming. Somebody in your household may eventually get a cold or the flu. But explain what cold and flu season means to a doctor.
There is a certain seasonality to illnesses, and we do see many more respiratory illnesses. Most of them are caused by viruses, occur in the fall and the winter months, and that's when people tend to be indoors, and they are sicker because of it.
Sure. We've had some pretty frigid temperatures already for this season, so a lot of kids are staying inside, obviously sharing germs with each other. Is that really how it happens? Is that the majority of the reason why people get sick this time of year?
Yes, that's exactly how it happens. The virus is transmitted through direct contact, through the doorknobs or pens or the mouse on the computer, and then if you then touch your eyes or your nose or your face, that you infect yourself, and it's easily spread from person to person. That germ can stay alive on a surface for almost a day. Wow. Outside the body, so it can be a pretty hardy little virus.
Sure. And what types of viruses are currently most prevalent? Is it just cold and flu, or are there others that we should be aware of this time of year as well?
I think you see a lot of different viruses. Most of them manifest as what's commonly known as a cold, but you have the rhinoviruses and the coronaviruses. You hear about influenza virus, which causes an illness that most people are somewhat familiar with. But you have other ones such as RSV and para-influenza viruses as well.
You mentioned the fact that obviously people are touching doorknobs and touching other things and exposing some germs to objects that we all kind of end up touching. But how are these viruses transmitted besides something like that? Is it mainly through coughing and that type of thing?
Yes, there are several ways they can be transmitted. If you cough or sneeze, get the virus on your hands and then touch something, it will stay there. Or if you sneeze the respiratory droplets on to somebody else, they can then breathe those in and become infected as well.
Sure, and then it's airborne and everybody's sharing that. What can we do in our workplaces to kind of maintain good health? Because these viruses, as you said, are going to be prevalent. In the school, obviously kids, you know, have the hand sanitizer, they're encouraged to wash their hands, but in the workplace specifically, what can we do?
I think you follow the same recommendations that we would for children at a school. It's good to have a bottle of hand sanitizer at your desk. Hand washing with soap and warm water will also get rid of those viruses, and so we just want to make sure that we keep a clean environment and realize that the best way to prevent it is to avoid touching yourself in your hands through your face and eyes and infecting yourself.
Let's talk, Dr. Coil, about some of the symptoms that you will notice right away when you either have cold or flu. What are some of the things that will first appear?
A lot of times the first symptoms would be a sore throat, followed by congestion in the nose, runny nose, followed by a cough. If you have a fever, sometimes that would be more indicative of an influenza infection, but they're very similar kind of infections with similar symptoms.
I think a lot of parents would probably rush their children right away to the doctor.
Right.
But we as adults sometimes think we can tough something like this out. So when should we pick up the phone, call the doctor, knowing that it's probably a little bit more serious? Is it so many days that we should wait, or the way we feel?
I think it's probably a little bit of both. Typically a respiratory infection, virus, a cold, is going to go away on its own in a week to 10 days. And it doesn't need any treatment, and there is not an antibiotic that we can give to make the cold go away faster. But if your cold is hanging on for 10 days or 2 weeks, or you're developing fever, it's probably time to think about getting to the doctor and having the check, see what's going on. If you're having problems with shortness of breath or problems breathing, then it would be another good reason to go be seen.
A lot of folks grab the first thing they can find on the store shelf in terms of just putting a Band-Aid on the problem, because it is in essence something like that. You know, you want immediate relief, so you're going to get something over the counter. We've also been told that sometimes an antibiotic, as you said, can't necessarily combat the common cold. But does it work on viral conditions, or is it strictly bacterial?
Antibiotic is strictly for bacterial infections, pneumonia, or maybe an ear infection in a child. It does not do anything for a viral infection. There's been no benefit. There are antivirals made specifically for things like influenza, but they're of no benefit in the common cold.
Also this time of year, we're talking about flu clinics. You see them pop up at a lot of different places, whether it be your pediatrician's office or a local pharmacy that's down the street. Should we be taking advantages of, this being offered to us as the public?
I think flu vaccines are a wonderful benefit, and people should take advantage of that more than what they do. The flu vaccine is the best way to protect against the flu infection, and sometimes the vaccine is better in some years, and sometimes it's not as good for protection. But right now, that's the best protection that we have, and I would encourage everybody to take advantage of that.
Age range, obviously there is one in terms of, I know small little babies cannot get the flu vaccine. But what about the elderly population? I know that we talk about that also, those folks being more at risk for something like this time of year. It could turn into pneumonia or something even more devastating.
And that is the population that we worry about, either the very young or the very old with complications from a flu infection. We like to vaccinate anybody that wants to. You're right, you cannot vaccinate children that are less than 6 months old, but anybody 6 months to 110 that would like a vaccination should probably get one.
Yeah, and this is something, again, that's usually available, not just if you don't have a prime care physician. You could go to a local, pharmacy of some sort and be able to take advantage of something like this.
Right.
People who choose not to be vaccinated and try the home remedies, good thing, bad thing? I mean, I know that doctors are always going to say, get vaccinated. But what if you try to tough it out because you're thinking you're building your immune system in some way?
And that may be okay in certain situations. Some people have a young, healthy immune system and they'd be fine getting through it. But others with lung disease, asthma, or emphysema, toughing it out is maybe not the best idea because they're set up to have a complication of pneumonia or a sinus infection or something secondary.
All right, and as far as prevention is concerned, what do we need to remember, things that we can do at home or at the office?
Try to get plenty of rest. As your immune system gets run down, that's when you're more at risk for infection. Being careful what you're touching and being healthy with good nutrition.
Yeah, you always have to remember those kind of things because I think everybody's on the go more or less this time of year too. As the holidays come around and we're all rushing around, that's something that we don't get enough of is sleep.
Exactly.
So it's a huge thing to be able to prevent any kind of infection coming on. Dr. Brent Coil, again, family practitioner, thank you so much for your time today.
Thank you.
We really appreciate it.